All right, I think you could begin.
Shalom, shalom. So the whole question of treatment that can be done on Shabbat, cannot be done on Shabbat, is based obviously on the understanding of what is the Isur, the Refuah on Shabbat. Everybody can see that, the Beit Yosef, is that up already? Yeah? No? The Beit Yosef is not up? That's a new share. Let's get this again. Up? What are we saying?
Mitsuyan.
Yeah?
Mitsuyan.
Now also? What are you saying? What's now?
Categories of illness. Very
good. Okay, more. So the Beit Yosef, in his opening to the laws of Pikuach Nefesh or Refuah on Shabbat, says Kol Refuah Asur Lasot b'Shabbat. That's the way the Torah opens. מתבאר מתוך הדינים שיבוא בסימן זה, וגם ממה שכתב בסימן הקודם לזה, החושש במותניו לא יסוך שמן וחומץ, ואסרין לאסור כרופא בשבת. So on the one hand, we say everything's asur on Shabbat. Pshita, the lav b'cholesh yesh bo sakana. We're obviously not talking about a cholesh yesh bo sakana. Shahrei mechalim alav et Shabbat. וגם אין לו בחולש שיש בו סכנת איבר, כמה. שהרי אפילו מלאכת דרבנן עושים לו. על ידי ישראל, וכמו שהתבאר בחולש שאין בו סכנה כלל, על ידי נוכרי, ועושים לו כל צרכיו, ילקח עד כאן לשונו. ביש לו, כן, על כל חלומה, we have to say, וביש כאן, יש בו מיחוש בעלמא, והוא מתחזק והולך כבריא. So the Shulchan Aruch, the Beit Yosef comes to say, what are we saying? When we say Kol Refuah Asur Shabbat, it can't be cholesh yesh bo sakana, it can't be sakana devar, it can't be cholesh she'en bo sakana. We must be talking about michush ba'alma. והוא מתחזק והולך כבריא. וכל גיא גבנה אין מתירים אפילו בשיבות דבריהם, אפילו דין אחרים, ולא עוד אלא אפילו שיבות דבריהם, די משום מלאכה גזרו, משום שחיקת סמנים. So in such a case, it is no refuah, then we have a gezerah of shchikat shamanim. ככה הם דברי משנה, והר"ן, והרשב"א, וכו'. So if we think about what the Shulchan Aruch talk about, there are basically four categories that the Shulchan Aruch speaks about of chole. There's chole she'en yesh bo sakana. There's chole she'en bo sakana. There's chole sakanat eva, and there's michush ba'alma. So when we think about what is the halachic status of the couple that are experiencing fertility challenges, where do they fit in? Are they cholesh sheyesh bo sakana? Cholesh she'en bo sakana? Are they have sakana devar? Are they michush ba'alma? Is it? And then the nafkamina, as the Shulchan Aruch just tells us, is that it depends what we're talking about. If it's cholesh she'en bo sakana, of course we can do anything on Shabbat. So another question. Cholesh she'en bo sakana, we can do alidei nochri. Sakana devar is a machlokas. We know whether it's like cholesh she'en bo sakana or not. And michush ba'alma, we can't do anything. So what is the definition of cholesh sheyesh bo sakana? So cholesh sheyesh bo sakana says the Rambam, Duchei Shabbat it's sakanat nefashot, keshar kol mitzvot. לפי החולה שיש בו סכנה, עושים לו כל צרכיו בשבת. על פי רופא אומן, according to the expert, doctor, in my opinion, what that means is according to what we would say today, current medical opinion, or accepted medical opinion, של אותו מקום, ספק שהוא צריך לחלל עליו שבת, ספק אין צריך, וכן אם רופא, אם אמר רופא לחלל עליו שבת, ורופא אחר אומר, אין, one said מחלל, one said not מחלל, אינו צריך, אז מחלים עליו את השבת, שספק נפשות נוחת את השבת. And therefore, says the Shulchan Aruch, מי שיש לו חולי של סכנה, מצווה לחלל עליו שבת, וזריב הרי זה משובח, ושואל הרי זה שופך דמים. So we all know that psak, as the Shulchan Aruch gives, that if we have a חולה שיש בו סכנה, of course we can do anything that needs to be done. There's a nice, the Gemara says, the Shmuel says, naherli, Shvile de Shmaya, Kishvile de Nahadra. So the Nishmat Avram has a nice explanation of this Gemara. He says, what's the pshat? Shvile Shmaya, Kishvile de Nahadra. What does he want to say? Well, what's the Shmuel was Mistovev in Nahadra, like we have the picture here of Bavel here. So what does it mean? So he says that Shmuel was a rofeh. And since Shmuel a rofeh, he spent all of his time looking around, treating patients. He went from this place, that place, and he was makir so well. Because every place he went to, he wanted to say, look, I'm a shabbat that's me that I went and I saved people, I did this mitzvah. In the same way that he also had, Iskei Shamayim, he was also mitasek ben. Even though he was a rofeh, he still had time to be mitasek ben Shamayim. It's an interesting idea. So can we say that a couple who are undergoing fertility treatment are cholesh yesh bach sakana. So I think that there's one situation we can, which is hyperstimulation. So hyperstimulation, OHSS, which is a ovarian hyperstimulation syndrome, is exaggerated response to excess hormones. We give hormones, and we've learned about it already. We spoke about IUI and IVF and ovulation induction. So we know that we're giving hormones. Now there are rare occurrences, excuse me, in which a woman has an exaggerated response, and they're usually women taking injectables, and the OHSS causes the ovaries to swell, become very, very painful, and it sometimes isn't. Obviously, women undergoing IVF because we give an ovulation induction, or not necessarily IVF. Only sometimes we give ovulation induction without doing IVF. So we've given the shots to create super ovulation without intended to do ovulation. And a woman hyperstimulated. It can also happen even just taking clomiphene. So if a woman takes clomiphene citrate, takes Clomid, she can also, if it's unbalanced, she could have hyperstimulation. And treatment, how do we treat OHSS? Excuse me, depends on the severity of the condition. It could require hospitalization and even more. And theoretically, there are cases in which severe OHSS could possibly be fatal. It's extremely rare. So if a woman has severe OHSS and she's on Shabbat and comes to the Rav, or we know that on Shabbat she had this terrible reaction, should she go to hospital? The answer is yes. That's Pikuach Nefesh. That's I think it's the really only case that we have in all of the gamut of fertility treatment. We're going to speak about in a moment what we're allowed to do, not allowed to do. The only case we have that's really Pikuach Nefesh is hyperstimulation. I don't think there's any other case which we have anything that's close to Pikuach Nefesh. Rabbi Aziz, I see your microphone is open.
I might be asking a question too early, but just broadly, if a woman who needs a fertility treatment is not a chola, then is the treatment considered refuah in the first place?
This is an excellent question. You did makdim et muchar. We're going to see that in a moment. All right, so here's a picture of the hyperstimulated ovaries. What we see today, if you imagine that you have a woman who's got PCO, and we give her a stimulation, then she's more likely to get the hyperstimulation. So we can predict the patient is likely to get that, but it doesn't necessarily mean that's what's going to happen. And women who don't have PCO can hyperstimulate. So maybe let's go to the least kal. The most chamor is cholesh sheyesh bo sakana. It's unlikely that we have. What's michush ba'alma? So what's the definition of michush ba'alma? The Shulchan Aruch says mishesh lo michush ba'alma v'hu mitasek v'olech b'bari. He's walking around and it looks okay. אסור לעשות לו שום רפואה, אפילו על ידי עקום גזירה משום שחיקת סממנים. So the whole din of שחיקת סממנים is only talking about מיחוש בעלמא. חולה שיש בו סכנה, אז ודאי not talking about. חולה שאין בו סכנה, we just said he can do על ידי הגוי. That's exactly the Shulchan Aruch. And therefore the only din that we speak about, that we teach, is the whole din of אסור רפואה is only talking about מיחוש בעלמא. What's michush ba'alma? So the Shulchan Aruch, it's very hard to define what the Shulchan says. The Shulchan says that this person is mitchazek v'olech bari. He's fine. So if he's fine, then he's not choleh. So michush ba'alma then becomes something that the person is functioning, and yet we see our perception of them is that they're functioning. They seem to be okay, and yet they know that they're still sick. They michush. They have the sense of being sick. Therefore, so that's clear that if we would think about it medically, the cholesh sheyesh bo sakana is a medical condition in which we have a doctor has said this is potentially dangerous, and a michush ba'alma is that we can see that that person's fine, and everybody can see that person's fine. We don't need a doctor to tell us that. That's clear. It's pashut. So what's in the middle? How do we define cholesh sheyesh bo sakana? What's the definition? So it's a whole philosophical discussion. We'll take a little bit. I've written about this extensively, but we'll think about a little bit of this few makorot. So the Gemara Masechet Shabbat says, "Amar Rav Nuna devar she'en bo sakana omer lo noch rivois." Davar Masechet says Rashi, "Cholesh im lo yasu lo refuah zeh ein musukan lamut u'mikom tzarich ula." So Rashi comes with a very interesting position. Rashi says, "What's cholesh sheyesh bo sakana? If we don't do it, he's going to die, or he's not going to die. He's going to get worse." But Rashi says here, this person is not going to die if we don't do this refuah. It's not a fatal condition. However, tzarich ula, he needs it. The person still needs that refuah. That's how Rashi defines en bo sakana. Omelan arami ve'oseh, aval davar sheyesh bo sakana, yisrael oseh batzmo. That already we saw. That's already pashut. The Aruch HaShulchan, based on that, on the juxtaposition of the two halachot, which says an interesting position. When we say chole she'ein bo sakana or chole bichlal, it has to be someone who's in bed, or yoshev al mitato, or is sitting on the bed. She'ein yecholto latzet mipetar beto, or at least is housebound. Not housebound because they've got a isolation because they may be sick, but someone who's not able to leave the house, they're at home, they're sick, I'm cholim. ויש בו חילוק בין יש בו סכנה לאין בו סכנה, כמו שבאר. Says the Aruch HaShulchan, the first category is you have to be sick. What do I mean sick? So it's the sick, as my perception is that person's so sick they're at home, or they're in bed, they're bedridden, they're house-ridden. If they're not bedridden or house-ridden, then cholet doesn't start. Then it's chimish balma. What's michush balma? Exactly what the Shulchan says. He's mitchazek v'olech kebari. If he's olech v'mitchazek b'bari, then he's clearly not cholet. So chole, whether it's yesh sakana, ain't sakana, the first category you have to be at home. You have to be bedridden. If not, then you're not a chole. But if you are bedridden, then we have a chiluk between if it's dangerous or not dangerous. That's what Rashi said. Sarich hula. That he needs this, he needs it because we know he's sick, and therefore he needs this treatment. אבל מי says the Aruch HaShulchan, אבל מי שיש לו מיחוש בעלמא, מיחוש בראש, או במעב, או בלב, וכיוצא בזה suffering, והוא מתחזק והולך כבריא, כמו שיש חלושים, מפני מיחושים, שיש להם שיעול, someone's gonna cough, וכיוצא בזה, והולכים ונוסעים, ועושים כל צר, persons go to work, and they מתחזק, and they're normal, they come to shul, בסדר. אין להם דין חולה כלל. ואסור לעשות להם רפואה, אפילו על ידי אינו יהודי, כזרע משום שחרר כסמנים. אך מי שיש לו מיחוש שעל ידי זה נחלש כל גופו. Someone who's got a sickness, a מיחוש, a subjective discomfort, that their whole body is נחלש, ואף שמתחזק והולך, אין לוחו כבדות ובחלישות, he goes sickly, and he's bent, and he's weak, ודינו כנפל למשכב, בחולה שם בסכנה. If he's in bed, if he's in bed, then he's in bed. But if he's walking around outside, but he's clearly shvach, he's clearly bent over and he's sick, then he's chole. He's as though he's in bed. So the Aruch HaShulchan is more pashut. The Aruch HaShulchan says, if you're in bed, you're chole. You're not in bed, you're not chole. Unless your whole body is nechlash, that's clearly you're in bed. The person can say, why are you in shul? Why did you come? You're coughing and spluttering, and you're shvach, you can't stand up. No, I come to shul, and machmir come to shul, and machmir to adbik everybody with my machala. I want to be bal chesed. I want to give everybody the sickness. So I come to shul. That doesn't mean you're chole. You're not chole. So the Aruch HaShulchan is not pushet. You're in bed. You're chole. You're not bed. Not chole. Let's go back to our condition. Someone is suffering from infertility. It's clearly not chole then, because they're not in bed. They're not bedridden. Not house ridden. They're clearly mitchazek v'olechem b'mayim. If that's the case, then michush balma. Why? Because it's subjective. They don't feel happy. They feel upset. They don't have any children. They're clearly not in bed. So the Aruch HaShulchan would say, "Lo cholim." That's what Rav Lior said to me. He said clearly, "Lo cholim." The same thing said to me Rav Neuvert Zatzal. He said that clearly that they're not cholim. Why? Because cholim, you have to have simanim being cholim. Just the fact that person doesn't have children doesn't make them to be cholim. However, the end of the Aruch HaShulchan seems to give a little bit of petach there. The end of Aruch HaShulchan says, if your whole body is affected by this thing, then maybe you are cholim. The Sitz Eliezer has a very fascinating tshuva that he says, what do we say about someone who stutters? נשאלתי במי שהוא כבד פה וכבד לשון, וציווה עליו הרויפה, בתורת התרופה, שיעשה בכל יום תקופה ממושכת תרגילים בצורה של הנשמה. He's doing breathing exercises, because he stutters. אם מותר לעשותם בשבת, והשואל רצה לאסור זאת משום איסור התעלמות בשבת, it's like exercise on Shabbat, don't do exercise, even though here he's not going to sweat, he's not going to schwitz in the exercise, still it's exercise, it's in a whole category of refuah, and therefore should be asur. Tshuva, לדעתי, listen to the Sitz Eliezer, לדעתי ברור שאיש כזה הוא בכלל חולה, איש כזה זה חולה, stutterers חולה, נו באמת, הגם שאין בו סכנה, even though there's no danger, because he's sick in his voice box, he's sick in his ability to speak. וכל דבר שחסר לאדם להיות שלם כיתר בני אדם נקרא שהוא חולה. Fascinating Agdara says that Sitz Eliezer. How do we define chole? Chole is sub-functioning as opposed to anybody else's functioning. So if a person stutters, they're chole. There's not a sakana. We can't point at something that this is their illness. The fact that they are stuttering shows that they are sub-functioning other than what is the norm for normal functioning for people. And therefore, that's considered חולה. וכל דבר חסר לאדם להיות שלם כי יתר בן אדם, נקרא שהוא חולה. ולא משנה אם זה מתבטא בצורה של כאבי ראש, ידיים, או רגליים. Doesn't matter if it's through a pain, a person's got a headache, their limbs ache, then we say that's חולה. וכדומה, בצורה של דפקט, באיזה עבר מרמ"ח איבריו מונע ממנו למלא תפקידו, מיועד לו. Or what is some other function of some other organ that disenables him to fulfill normal functioning, the function of tafkid miyad lo, their regular functioning. And therefore, says the Tzitz Eliezer, have a completely different understanding of chole. The Aruch HaShulchan, what was chole? Whoever's in bed, or bedridden, or house-ridden. Simple. You're not bedridden, house-ridden, unless the whole body's affected. Atabari. And therefore, clearly someone who's suffering from infertility is clearly not chole, the pashut. However, the Tzitz Eliezer have a completely different definition of chole bichlal. What's chole, says the Tzitz Eliezer? Chole is sub-functioning. If there's a functioning, this is the normal functioning, there's 100%, and you are on 50%, that's chole. Sometimes it's chole, I'm just in incredible pain, that my head, I have a huge headache, and I've got a migraine, I have to be in bed. And sometimes my ke'ev is I'm not able to speak properly, I'm stuttering, and therefore the way to get over the stuttering is the breathing exercises, and therefore I'm allowed to do Shabbat. It's not that's a chole. It's chole she'en bo sakana. It's clearly, or maybe sakana devar, but it's clearly there's no sakana here. However, it's still chole. So it's a completely different definition of chole. Chole is everybody functions this way, and I function a different way. Now, if we think of that in relation to fertility, avadai, someone that's infertile is clearly chole, if that's the case. Why? Because clearly a woman who's not ovulating, or a man who has problem with sperm production, or a couple that for some unexplained reason that we don't know is not able to procreate, we would say they are sub-functioning. Then what's the norm? The norm is that a couple after X amount of time have children. After 12 months, they'll have children. That's the norm that we've already discussed at length. And therefore, that's the norm. This couple are not there. They're not at that norm. And therefore, we would have to survive. We would have to find them. We have to categorize them as chole. Ken.
That's a question.
Bevadai.
But the Tzitz Eliezer is talking about doing exercise. You're comparing doing fertility to exercise?
Nifla. However, so if the Tzitz Eliezer says the reason I'm saying that category is because then we can do exercise. That's one thing. The Tzitz Eliezer opens up his tshuva saying, how do we define illness? In the same way that the Aruch HaShulchan opens his previous seif with how do we define illness? And the Tzitz Eliezer says we define illness this way, and that then we get into the question of we're allowed to do exercise or not. So he doesn't say I'm matir exercise because exercise is not really refuah and it's okay, and therefore that's not what he says. That would be a perfectly legitimate answer, but that's not what he says. The Tzitz Eliezer says when I think of this question, I think how do I define illness? And his illness is defined as sub-functioning, not as being in bed. And now let's talk about the question of doing exercise. So I think he's very clear about that. That's what he says in his tshuva. Agav, there's a beautiful tshuva.
I'm sorry, Rebbe. I'm sorry. It's so interesting because based on the two questions from Rabbi Aziz and Rabbi Bukiad, mitzad echad, maybe you're not considered a chola, and you don't want to be a chola because then you could be treated, it's not refuah. And on the other hand, maybe you do want to be a chola, that Tzitz Eliezer wants you saying it is chola, and that's what you're getting at. And then what you're allowed to do, so Rabbi Bukiad is saying, well, is this the same as stam exercise? But depending on how you set it up, you're allowing for more treatment or less treatment. We haven't figured out which is the better place to be, but mehanish nehat stadim, you're looking for an advantage for what's the best place to be identified.
However, if we just think of what the poskim that I mentioned before, so Rav Neuwirth Zatzal said, because I don't think that the fertility patient is choleh, I don't think we're allowed to do any treatment at all. They didn't say, therefore it's not treatment. It's clearly a medical procedure. You go to a doctor. We give you ovulation induction. We do things which are clearly part of refuah. However, because I define them as not choleh, therefore you're not allowed to do on Shabbat. He didn't say what Rabbi Aziz wanted to say, and therefore it's not refuah. That's a good answer, but it's not what he said. Whereas if we say that Tzitz Eliezer's answer, as we saw from other poskim, we'll see in a moment what other poskim said, so then maybe we would be able to do refuah. I think it's hard to define a fertility treatment not as refuah. That's hard to say. If you take, nobody takes Clomid who's bari. Nobody bari takes clomid. Bari people take vitamins. Bari people drink chicken soup. But no bari person takes clomid. Nobody.
But there is a Bet Yosef. I don't know if the Ashkenazim use it, but I know we use it for vitamin.
Ashkenazim don't use the Bet Yosef.
We take vitamins on Shabbat though for that exact reason.
Because it's not cholet. Nachon, it's different. Moshe has a tshuva about it. Others, yes, poskim al zeh. Whether we can say that's refuah or not refuah. Ani maskim b'me'achuz, because you say ze machal bari, ein achinami. There's a lot of yeshavei achronim the matir. Ani maskim itcha. Ashkenazim and Sfardim. V'vadai. However, that's a sheila acheret. I don't think we can say if you're not cholet, therefore whatever you do is included in what bari do is there's those two things are not the same. Yeah. Because no normal person takes clomid unless they need it. There's clearly that it's refuah. I think that's hard to say. What does the Shmer Shabbat say? Shmer Shabbat has a whole different kivun we want to say. What about mitzter? Mitzter is a whole different category. Ein moxia. A person's mitzter halbe. Then diloke cholesh en b'sakana. And he says, look in also in Kalkalat Shabbat, and in Israel, but in Amar Anochi, Mevi didn't miksat chole v'yesh lo ma'akol lefi enyan. So what do we say mitzter halbe? Mitzter. How does that fit into the equation? So he says the different opinions. Some say it's chole she'en bo sakana. Some say it's kemiksat chole michush balma. Akol lefi maybe yesh lo ma'akol lefi enyan. How much sar do we have? Can we put a sar as a factor included in our definition of what's choleh? At the end of the day, refuah is to alleviate suffering. That's the whole point. So this is interesting Gemara in Shabbat. Gemara in Shabbat, Daf Nun Amud Bet, says, Tanya megarer Adam gildei tzoah v'gildei makash al besaro b'shvil tzaro b'shvil yapot asur. A person's allowed to remove a scab or move a feces or remove a scab from his body if it's fetzar, if it's uncomfortable, it's unpleasant. If it's in order to be beautified, then it's a sore because that's considered to be beged isha. It's considered to be something. Beautifying your body is not a male activity; it's a female activity. So says the Tosfot, a very choshev of Tosfot. Tosfot b'shvil tzaro v'im ein lo tzar acher ela shemitbayesh lelech ben bnei adam shari. And if the person has the only suffering they had is not a physical suffering, but he's mitbayesh, they have a busha lelech ben bnei adam. He has a busha, has an embarrassment. He has a shame to go among other people. Shari, zmuter. The ein lecha tsar gadol mise, because there's no greater tsar. When we talk about the question of tsar is, says the Tosfot, is not only a physical quantity; it's a psychological quantity. When we think of the definition of how much pain a person has, psychological pain, says the Tosfot, is not just pain. Ein lecha tsar gadol mise. That the embarrassment, the shame a person has, that's already something that is very, very strong. Can we say, due to that shame, due to that embarrassment, due to that discomfort, that psychological discomfort that a person has, would we consider that almost to take them, as we saw before in the Shemot Shabbat, to Choleh Sheyesh Bo Sakana? And the Gemara tells us, Gemara in Sech Nadarim, the Gemara Yeduim, says Amar Bishum Levi, Kol Adam she'en lo banim chashuv kamet, shene'emar havali banim v'nai met anochi. Give me children, otherwise I'm dying. But Tanya says the Gemara, Arba chashuvim kamet, ani u'metzoah suma u'mi she'en lo banim. Ani dichtiv ki metu kol nashim, and metu they didn't die. The Tanavarim was still alive. However, it was like the metu. Metzoah dichtiv al na tehi kamet by the tefillah of Moshe Rabbeinu. V'suma dichtiv k'ma hashekivim hoshivani k'ma teolam v'yusam tisha b'av u'mi she'en lo banim dichtiv ali banim v'amayit anochi. So Rav Zilberstein said to me, my father-in-law already said there's a pasuk, the pasuk with Rosh, Avali banim v'bayimeit anochi, that it's mamash nechshav kamet. Nechshav kamet, we have a chovah to alleviate that suffering. I.e., the suffering is that a person is in such anguish that we can consider it almost like cholet. And therefore, the Gemara says, it's keilu chashuv kemet, it's metchiat hametim to help such a person. Rav Shechter once said to me that if that's the case, he said that I think that with Meir Twersky, I think he said that his mother had written an article, I think so, that it said that that whole thing, that whole premise doesn't make any sense. Why? Because if that's the case, someone that's poor would also be allowed to mechalel Shabbat. Is a person that's poor allowed to mechalel Shabbat? Why? It says ani is also neshav kemet. In the same way, they're not allowed to mechalel Shabbat for an ani. No, mechalel Shabbat for someone who doesn't have children. But b'chol ofen, Rabbi Yashiv told me acheret. I think it's very interesting to see. We always think that women are very depressed and generally suffer from childlessness, from having fertility problems. There was an article that appeared in I don't remember what it is. You'll see when you when you get the you see exactly what it is. I don't remember where, but the British Sociological Association they suggested that men are about as likely to as women to want children. And they also feel isolated, and they also feel depressed, and they also have anger, and all of the other pressures that women have. It's not as women have this desire to have children. Men also have a desire to have children. So could a man be treated as he doesn't have that havali benim v'may metanochi? Says the research seems to say differently that men also suffer. Men also have pain. So let's see Lamaisa what the poskim said. So who said michush ba'alma? Rav Neuwirth said to me, it's michush b'alma. That fertility treatment is not the Shabbat, pashut. And he said to me a beautiful thing. He said, and I've used this word from Rav Neuwirth many times, quite successfully. It's a good word. He said the following. He said, women ask me, couples ask me, can they do treatment on Shabbat? I said, no. And he said, but we have to, otherwise we won't have children. So he said, the schut of keeping Shabbat will stand li'atchem, will be your Melitz Yoshe, no less than doing the treatment. I don't think that doing the treatment, if you don't do treatment on Shabbat, we're never gonna have children. Keeping Shabbat is all Kadosh Baruch Hu likes people to keep Shabbat. I use that, so that's a very interesting word. I use it many times to couples. So the things that I thought were sore. I said the schut of keeping Shabbat is also chashuv. It's a mod chashuv. Otherwise, it sounds like we don't give credence to that person's pain. We just saw men, women have pain. The doctors say we have to do Shabbat, and what the rabbi is now coming say we can't do Shabbat. So the schut of keeping Shabbat is gam chashuv. If I did that we keep Shabbat, Kadosh Baruch Hu likes people to keep Shabbat. We tell them sachar. So that's I think the very chashuv. Rav Dov Lior, the Rav of Kiryat Arba, Hebron, said to me the same. Aruch HaShulchan. So the Litaim, like myself, who we follow the Aruch HaShulchan. My Zayda had was a Talmud of the Chazon Yechezkel, who got smicha from the Aruch HaShulchan. So by that was what we spoke about. Aruch HaShulchan, he had a big Aruch HaShulchan behind him on his shelf. But that Mishnah Berurah, the bottom shelf, like behind the cassette, the Safada was a Mishnah Berurah. Because every year should have a Mishnah Berurah, but he never actually learned a Mishnah Berurah. Like Aruch HaShulchan. So Rav Devlio, the Aruch HaShulchan. Aruch HaShulchan says you have to be in bed, not in bed. Gamal, that's it, finished. But Farkash from one of the big poskim in Chabad said to me the same thing. Michush b'alma, they're not considered to be chol. However, Rav Nevin said had a very interesting position. He thought it was sakanat evar. Sakanat evar, possibly on the same svar that we just said as Sicilianism. The sakanat evar doesn't mean the person is going to lose the evar. It means the evar is not functioning. And since the evar is not functioning, what's not functioning? The ovary is not functioning. The woman's not getting pregnant. The ovary is not functioning. Therefore, we can call it sakanat evar. The treatment of it is to stop that sub-functioning. The sakanat evar doesn't mean there's a sakanat evar, ayin shemerda, that we think the iron is going to leave the body, like the Gemara says in Avodah Zarah. Rather, that the sakanat evar means that this evar is not functioning, like we saw Tzitali. The problem with the Rav Neuwirth's position is that it's only that not all cases is the sakanat evar. Not all cases is there's a sub-function of an organ. It is if a woman's not ovulating, and so we give ovulation induction. But there are many cases in which there's no sakanat evar. The woman is ovulating. She's had perfectly normal ovulation. We're still getting ovulation induction because she didn't get pregnant. Or we're doing an IVF because of PGD, or we're doing an IVF because there's a male factor. So it's not in every single case we say the sakanat evar. In some cases we say sakanat evar. Most of the poskim that I spoke to thought that it was holesh and b'sakana. Rav Elyoshev told me that. I heard also from Rav Zilberstein told me the name of Rav Elyoshev. I heard it from Rav Elyoshev himself Why? Because you just saw it, they're subfunctioning. We saw that they have tsar. We just saw it from Rav Yosef said, Pasuk, Rav Mordechai Eliyahu was of that opinion that it was. He told me also thought it was Chol Hashem B'Sakana. Clearly, Rav Zalman Nechemia Goldberg thought it was Chol Hashem B'Sakana. Rav Yaakov Ariel thought it was Chol Hashem B'Sakana. Rav Zalman Nechemia Goldberg is a hemshech lechora many times of Psakim of Shlomo Zalman. I never asked the question of Shlomo Zalman. Aval Shal Jodam, and they thought it was clearly it was Chol Hashem B'Sakana, and that claims to be the pretty much accepted opinion. I'm saying there are many people don't. Rav Shachter didn't hold that. Rav Shachter thought it was also Michush Balman. There are many poskim who think Michush Balman, but there's many people who thought it was Choleh She'ein Bo Sakana as well. So the nafka min is huge, and what are we able to do? So I wrote this many years ago in an article in Tchumen, and Rav Yisrael Rosen Zatzal, who was the editor of Tchumen, he put it in. I was a young man at the time, so he put it in. And he met a friend of mine afterwards, and he said, "Oh, your friend, your colleague wrote an article and put it in Tchumen." He said, "I disagree with every single word he said. Every word he said is wrong. Why? But he said, so my friend says, how do you put in the article? How do you accept it?" He said, "It was well written. It was a good article, but I disagree with everything he said." So yes, yes. Well, b'chol ofen, I think it's pretty much accepted that that's the idea. I think what's very and fascinating, I saw many years ago a letter that appeared in Fertility and Sterility. Fertility and Sterility is the one of the most important journals in the field, in the peer-reviewed journals, the Journal of the American Society of Reproductive Medicine. And there was a letter quite a few years ago, I think it's in 2000, 20 years ago, that they said the following, that the letter was called "Infertility is a Symptom, Not a Disease." And I just read the beginning, the idea that it says. An otherwise excellent article, editorial that appeared in this journal concerning the problems created by the failure of the health insurance industry to provide coverage for fertility, the author, a noted academician and clinician, repeatedly referred to infertility as a disease. There's a disease called infertility. The mistaken idea that infertility is a disease is commonplace, not only among academicians and clinicians, but also among third-party payers and the general public, and is one of the reasons that fertility is not covered by most insurance plans, because it's outside of what we cover as a disease. The facts are that fertility and its frequent companion, anovulation, a woman not ovulating, are not diseases. They are symptoms of underlying, sometimes serious disease in one or both marital partners. One result of considering fertility and ovulation as diseases rather than symptoms is that unnecessarily powerful and expensive treatments may be used to obtain an immediate pregnancy, whereas chronic disease that may affect lifelong health is overlooked. Just as the symptoms, chronic headache, chronic stomach pain, and chronic chest pain may be caused by underlying disease, so may infertility caused by underlying disease. Endometriosis, we've spoken about, and uterine fibroids, benign ovarian tumors, and pelvic adhesion disease are all causes of infertility that can be treated by laparoscopy if detected early, but may require more extensive surgery later if they remain undiagnosed. And ovulation may be due to insulin resistance that can result in diabetes or cardiovascular disease later in life, or any number of other endocrine disorders with lifelong effects. I think it's a very fascinating idea. We're discussing how do we define disease for halachic purposes. But here, Dickian and his colleagues are speaking about how do we define disease when we talk about treatment. And that idea that infertility is not there's no disease called infertility as a disease. Infertility as a result of other underlying factors. That's very important when we think about treating, when we think about suggesting treatment. Because what we often do, especially unfortunately in America, where it's often based it's powered by how much people pay and how quickly we want to get them treated, is that what we do is we give a person treatment to get them pregnant. And when we get them pregnant, we've solved infertility. We haven't solved the actual disease. The actual disease is something completely different. So I think that this whole debate about whether infertility is a disease or not, and we just had a little bit among ourselves, even here, to think about, is it treating, neutral treatment, is it normative treatment or not, is very much also mirrored in the literature, in the medical concept of what considered to be, how do we look at fertility in of itself. So let's talk Lamaisa. We'll talk Lamaisa, what are we allowed to do or not? So let's think about what can we do. Testing. How much testing can we do on Shabbat? Can we do ovulation on Shabbat? We're doing a basal body temperature. We're doing a home test is not a problem. Rav Noivin, who thought that, as we just said quite clearly, that fertility was not a choleh, didn't think it was a problem doing ovulation test on Shabbat. He said the same. He said in the name of Rav Yosef. Again, I never asked Rav Yosef this question, but he told me in the name of Rav Yosef that he'd asked Rav Yosef, and he thought it was mutter to do a home test. Why? The two svarot. A, because it's not really tzvia, because it's a chemical change, and B, it's not tzvia letzorach. I have no interest in it. Question is, once I've done the home test, which is basically a dipstick placed in the urine, is at that point, does it become muksa? That's a good question. Generally, once you do it, you see that it's yes or no, it should be thrown away while you have it in your hand anyway. It shouldn't be left around. So that's not a problem. That's not a problem on Shabbat. Doing a blood test is a problem on Shabbat. Why? Because I don't need to do it on Shabbat. There's almost no case I would need to do a blood test on Shabbat. Same now when we're doing the semen analysis on Shabbat. I don't need to do an ultrasound on Shabbat. I don't need to test ovulation by doing all these things on Shabbat, right? So the home kit to do a testing ovulation, a home kit is one thing. To do it in a lab, to do a blood test, to use electricity is already a different, and there's no absolute reason to do it. And therefore, a woman wants to do ovulation test at home, the chor mutar. But only if the other test to do it in a lab, the chor will be asur. And in similar answers, clearly there's no reason to do it on Shabbat. There's an interesting tshuva. When we were still using basal body temperature, when we were testing what is the temperature to see the change around the time of ovulation, but Moshe has a tshuva about it. And Moshe tshuva says that it's called medida shel mitzvah. Since the question was using a mercury thermometer, of course, doesn't exist anymore because we found out that mercury is carcinogenic and is a terrible thing to use. But at the time when I was younger, we used mercury thermometers, and they would break, and you'd have mercury all over your house, and nobody died from it. But b'chol ofen, the Rav Moshe thought it was a medida shel mitzvah. It's famous at the end of the Gemara and the end of Shabbat, very famous Gemara about medida shel mitzvah. The Tzitz Eliezer has an even more fascinating tshuva. Tzitz Eliezer says, why is it mutter? Because he said if the couple didn't know, it would cause them a pagia on Onik Shabbat, and therefore, since the pagia on Onik Shabbat, we're allowed to do it. We're allowed to test the basal body temperature. I love the tshuva because if you think of it logically, it's actually fascinating. What does it mean that they would cause them a pagia Shabbat in Onik Shabbat, and what would happen? So if the woman ovulates, we're talking about ovulated testing the first time in the morning. So she gets up Shabbat morning and she tests, I'm ovulating. And what? And now they're going to have relations now? He's not going to go to shul, they're going to have relations? Well, we assume that if she already went to mikveh, they already had relations Friday night. I think that's generally an assumption they will have relations Friday night. And therefore, if they're going to get pregnant, they're going to get pregnant anyway, whether she's ovulating to this morning or ovulating yesterday. And there's absolutely zero nafka mina. They're not going to do anything different, because she finds out Shabbat morning she's ovulating. And still, the Tzitz Eliezer thought it was a pagami on Shabbat, not to find out. Why? To understand what the Tzitz Eliezer is saying to follow. That he's saying, not that they know that somehow we're going to do something different, and therefore that's pagami on Shabbat. Pagami on Shabbat means that if I'm in the pressure of trying to get pregnant, and you stop me and say you can't test it, that's going to increase my pressure. And that's something we want to do. We want to alleviate pressure, we want to increase pressure. That's something very important to think about when we speak about, even the times when we're also, like the Shmir Shabbat Kilchata said to me, that even when I'm also, I have to give an answer why, and I have to give hope to the people. And that's what his hope was. You keep Shabbat, that's the hope. That idea is very, very important. That we need to think, what is the psychological state of the person that's testing ovulation, and to explain to them how we're able to do it halachically. In the same way, we would say probably that since we don't think there's a problem in doing the home test, will be okay. What about treatment? So taking any medication, have you sort of shichat zmanim? Of course, many dachronim say, as we just said before, there's maybe not an issue of shichat zmanim today, and we're maybe many are more mekel. The other possibility is to do a shinoi, since it's clearly gezer darabanan. What if we do a shinoi? We take the medication. The minhag Yerushalayim, when he wanted to take medication, was to eat it with a knife and fork. There was heard from old Yerushalmi, they'll tell you that they would eat it with a knife and fork, and it's not it's shinoi. That's not a way. It's not becomes ochel. Doesn't become. There's a little bit we said before that somebody becomes ochel. It's mutter. So we can take with shinoi. Maybe we take the medication with shinoi. It should be noted that many times the medication does not need to be taken at a specific time. and therefore taking a tablet, let's say taking Clomid, it doesn't necessarily have to be taken at 8 o'clock in the evening. It can be taken at 6 o'clock in the evening and at 9 o'clock in the evening. And therefore, in most cases, of course, when we get to cases of 2 days Rosh Hashanah and Shabbat and 2 days of Rosh Hashanah, we have to have some time we take it. But in generally taking a regular Shabbat, you can take before Shabbat comes in, after Shabbat went out. Generally, it doesn't have to be so time related, but it's something you should hear from the doctor. The question of taking shots, we're going to give ovulation induction in the case of shots. We're going to give gonal F, and we're going to give Ovitrel and the other shots that we discussed. So the question of taking shots is if we have a subcutaneous or intramuscular shot, then according to Kimat all the poskim, it's not Isur. What's the Isur? The Isur is to give an intravenous shot. Intravenous shot is to give the shot which is inside the vein. Why is that? Anybody who's ever given intravenous shot will know that you have to make sure you're in the vein, and therefore you have an interest in drawing blood first to make sure I'm in the vein, and then to give the shot. And therefore I have an interest in the blood coming in. A subcutaneous underneath the skin or intramuscular into the muscle, I have no interest in the blood coming in. Therefore, even if blood comes out, I have there's no issur of dash, there's no issur of svir, there's no issur of netilat neshama, all of the things that the Rishonim said the problem of drawing blood on Shabbat is because I don't have interest in that blood. So therefore, if the most it's situation or nichale, the would be mutter. So I saw somebody wrote this, a book came out many years ago called B'nai Banim that he spoke about, and he said, if it's an intravenous shot, it's a sore, and a subcutaneous shot, it's mutar. The only problem is that there's no intravenous shots in fertility. All the shots in fertility are subcutaneous or intramuscular, and the way you know that is because people give themselves. A person who self-administers the shots, what do they say? Just stick it into your legs, stick it in your stomach. In such a case, they're not intravenous. Intravenous, you have to have a little bit of understanding what you need to be a nurse or a heroin addict. It's hard to give an intravenous shot. You have to actually know what you're doing. So therefore, the fact that people are doing it, have zero medical knowledge, tells you already that it's intramuscular shots. They're subcutaneous shots. It's not a problem. And therefore, there's no problem giving it. There is a problem of attaching the needle to the body of the shot, because that is already a question of boner. So do that before. Make sure you do it before. Cleaning off the side of the injection. Take a swab and cleaning it carefully without doing schita. The chor would be mutter. What about an IUI? Can we do an IUI on Shabbat? Generally, it's very, very important to think about the timing. And the timing means that we can basically, if we give ovulation induction and we carefully monitor our patient, we can, in almost all cases, get to the point in which we will not have to do a treatment on Shabbat, not an IUI, not an IVF. And you'll speak, and you'll speak to your from reproductive endocrinologists in your communities. You'll see that some of them never ever do on Shabbat, and some do every Shabbat. And the reason for that, if you speak to people that never ever do on Shabbat, it's because they know they have no interest in coming on Shabbat. They want to be at home with Shabbat with their families as well. And they know that, and therefore they are able to induce and to pick up and to do treatments in which they will never get to that. And so it's very important going in to know that the patient should tell the doctor that we cannot do it on a Saturday. And therefore we have to do all of the efforts we can in order to make sure that we do not get into the question of having to undergo this on Shabbat. And the doctor will, with a little bit of sechel and a little bit of good timing, will be able to change it. The other thing is that we don't always have to do it exactly on the day at the time of ovulation. So we can, if we do an IUI the day before or 12 hours before, generally okay. So if we have, instead of doing on a Shabbat morning, Friday afternoon, we'll probably get pretty much the same effect in almost all cases. And the same thing, we don't do it on Shabbat morning, we'll do it in the Shabbat after evening, we'll do it Motzei Shabbat. Generally, we can solve the problem. It's very important to think about that. It is very true that timing is not so appropriate around the Chagim. And therefore, if couples come to you, melichatchila, we should very carefully guide couples that around the Chagim, they shouldn't start any treatment. We generally should say around Pesach and around Tishrei, a couple does not start treatment because it's almost impossible to get around the time. If you have a non-Jewish staff, we have Amir al-Nochri, we have Choleshem Bosakana, according to many poskim, they have a Horetz Mutter. However, the problem is you have a Jewish doctor, you have a Jewish staff. So the question is, if we have a Jewish doctor, we're not allowed to, because the Jews not allowed to do is Vadai Mechalel Shabbat. Even he's okay with Vadai Mechalel Shabbat. And the question, do we have to find out? Do we have to look and see, is all the stuff 100% goyim? Or maybe someone had a Jewish grandmother. And the question is, how much do we have to look into it? So many poskim said that we don't have to look into it. However, if we know, then we don't have a Jewish doctor. It's better to have a non-Jewish doctor. But of course, many from you like to have a Jewish doctor if it was better. However, in this case, it happens to be bad. Even if you have a non-Jewish doctor, getting it to and from the hospital is a big question. How do we get there? So many couples, I had the case of that recently, that a guy said, okay, I'll go and stay. I'll take a hotel and I'll stay next to the hospital. And you're going to walk there. Okay, everybody's going. And you can walk there. The Chor's mutar. The question, of course, we have the supervision. Supervision on Shabbat is not so pashut. Unfortunately, in America, almost every Shabbat we have supervision because couples didn't time it well. And a supervisor also has to stay in a hotel. So we have now 2 people staying in a hotel, or 3 people staying in a hotel, husband, wife, and the supervisor all staying in one room. And it's interesting Shabbat. So that's things we need to think about. The best, as we said before, if we can, is to time it that we do not have that question. The same thing with IVF, timing. We have a question about now. The problem with IUI is in the end of the day an hour process. IVF is a 3-5-6 day process, and so it's almost impossible not to get a Shabbat in the middle. But there's a difference between having a retrieval and having an embryo check. So a retrieval we're not doing on Shabbat, but the embryo check almost always has to be done on Shabbat. Not 100% true, because there are many days in the middle that we don't need to touch the embryos. Day 2, you don't need to touch the embryo. You need to touch the embryo on day 1. On day 0. Day 1, you don't need to touch it. Day 2, you need to touch it. Day 4, you don't need to touch it. So there's a way to get around it again with good timing that we don't, in fact, need to even do an embryo check. Today, very much with the embryo that we're using, as you saw with the IVF, that we're using the embryoscope, which is automatic. We don't really even need to touch it. And the transfer shouldn't be done on Shabbat. Remember, the retrieval is around when a woman ovulates. That we don't have too much control about. We have a lot of control when we transfer. We can transfer on day 5. We can transfer on day 6. I think I told you I once sat with an embryologist, and we had a question about treatments on Shabbat, and we wanted to get around it. And I sat with her about 2 hours and went through every single combination of every single permutation of every single treatment. And I said, what could we do if it fell on Shabbat? And she told me we could do a day 7 transfer even. She was willing to go for day 7. And not everybody's willing to do that, but she was willing to do that. And so it's important to think, we can push the transfer. The worst thing is we can also freeze everything and transfer next month. That's also a possibility. Remember that we're talking, the difference, of course, is between a woman who's 30 and a woman who's 46 or 45. This is her last chance of having an IVF. It's not so easy in that case to stop. There's also, but inside the IVF, there's also a question. The boreh would boreh the sperm from the good sperm from the bad sperm. That's already embryologist. Again, we get a question of supervision. So there's a lot of questions around, even though there are a lot of things we can do, there's a lot of questions around IVF that are not so pashut. We should try to guide our couples, de jure, that they shouldn't get into these questions of doing it on Shabbat. And we need to, then we have the answer. Take a few minutes, that nice article that he wrote that appeared in RJJ and appeared in Tchumen about doing a Brit Milah on Shabbat. One of my Talmidim here said he asked Rav Shechter this question last week, and Rav Shechter said very different than what we're going to say now. So, what's this question? So the Gemara Masechet Shabbat says, Amar Kra, Bayom afilu b'Shabbat, we do Brit Milah b'Shabbat. However, everyone knows the Gemara, you'll see the Gemara inside, that in the case of Safek, then we don't doche Shabbat. What's Safek? Nolad ben Hashmashot, Nolad Mahul, with Yotze Dofen, Safek ben Sheva, Safek ben Shmone. So in all these cases, we don't do Brit Milah on Shabbat. The Gemara Masechet Hagiga says, Shaludra ben Zoma, you remember the Gemara? Betula, Shibra, Ma'u leKohen Gadol, Michashinam leDeshmul, Damar Shmul, Yecholni levol kama bilot velo dam, Udin leShmuel lo chashchicha. No, the idea that a woman can be betula and can be beula is impossible. What's talking about Chashina and Neshira Bambati? The Babbeinu Chanan says Neshira Bambati is Maseh Nisim, and therefore he says ve'ena tmeya leida. Since it's Maseh Nisim, we don't have the continuum Vishaki Tazriya ve'alda zachar. Then therefore there's no tumat leida. That's the Rabbeinu Chanan. If that's the case, then says Rosh Shlomo Zalman Yecholiyot that we don't do Brit Milah on Shabbat. Why? Because if we don't have Ishaki Tazriya, V'yalda Zachar, and therefore we don't have the question of Ubayom Hashmini, Mod B'Solato, because we don't have the limud of the pasuk Bayom Afilu B'Shabbat. That's Rosh Shlomo Zalman's shaila. So Wahud Matirim and said we do Brit Milah on Shabbat. This is a long article. You can read it again. RJJ, I'm Tumim, we have it. Ravadia says there's no case in the Gemara that the Gemara says that the suffix is how the child was conceived. The Rav Avadia says the only suffix is how the child was delivered. Nolad ben Hashmashot, Nolad Mahul, Safek ben Shiva, Safek ben Shmona, Yotzei Dofen. They're all about how the child was delivered. There's not a question about how the child was conceived, and therefore the Rabbeinu Chananel lo masakin. That's not. There was no shayla about how the child was conceived. That's Rav Avadia's answer. Rav Meliyahu told me there's no kol Maaseh Nisim. Why? I said, what's Rav Meliyahu? What's Maaseh Nisim? He said, Maaseh Nisim. When you have the meeting between sperm and egg, that's not Maaseh Nisim. What's Maaseh Nisim? So I said, if you would take a haploidization, we would create a sperm cell and we create an egg cell. Would that be called Maaseh Nisim? He said, no. The fact that you created a sperm cell is very smart, but it's still not Maaseh Nisim. I said, okay, so if we could clone a person, would that be Maaseh Nisim? Oh, that's already Maaseh Nisim. Maaseh Nisim is something that's impossible in the norm to understand. Therefore, it's we don't do it. However, here it's Maaseh Nisim. It's a norm. It's a normal meeting of sperm and egg. Rosh Hashanah Orbach Lamaisa, his children said Lamaisa. He said the Brit Milah is done on Shabbat. This is a good shaila, but my says Moti Chalbron wanted to say that Rav Shlomo Zalman is machmir. It's not true. But the children of Rav Shlomo Zalman's children said that actually Maisa he was supposed to take them. The Shevet HaLevi says the following: Ledidi ein shum safek klal beze upshita denidon keleida lekol devarei v'doche Shabbat v'yom tov. Kevan debemet ein shum safek d'azra malachutit gorem ibur v'leida tivit. It's normal. It's actually normal, like we just saw Rav Eliyahu. וגם עצם הזרעה אינה בגדר מעשה ניסים בלתי טבעי, זה ככה נורמל. ואם לדעת הרב אינו חננאל, נתבע במבטי אינה בכלל אישה כי תזריע, הרגיל עד שאינו דוחה שבת הסמוך במקרא, היינו משום דהבי דבר שאינו שריר. It's impossible, it's unlikely, it's uncommon. ואינו טבעי לדעתו גדולה. לא כן הזרעה מלאכותית, שנתינת הזרע ממקום הראוי ואופנים הראויים גורם על קליטת איפור. It's exactly the same, we're copying nature, it's טבעי. מלבד מה שכל הראשונים יש להם גרסה ודרך אחר בשמת החגיגה. So the Shevet HaLevi seems to take all of the three tshuvas we had before. Rav Vadia, he says, we don't agree with Rabbeinu Chanel. He says, like Rav Eliyahu, it's not Maaseh Nisim. Why? Because it's normally TV, and it's also Shachiach. It's also the right that we have the whole time. Therefore, the Shevet HaLevi says, Lamaisa, ain't Shum Bayah. The Brit Milah is done on Shabbat, it's a regular Leida and Shum Sheh. Rav Elioshiv had the most interesting tshuva. So Rav Elioshiv asked him, what did he think? So Rav Elioshiv said to me, the IUI is Doche Shabbat, and an IVF is not Doche Shabbat. Why? He said, Rabbeinu Chanan. Rabbeinu Chanan. Okay, that was it. That was what he said. I didn't ask, is it Rabbeinu Chanan? That was it. That was the answer. What's the Rabbeinu Chanan? Rabbeinu Chanan is the following. This, I think, if you teach, some people want to give a shir to Balibatim, this is the most chazak shir I think you can give. I've given it many places around the world. This is a very, very chazak shir. Says the Rabbi Chanan in Kovet Shurim, the Perush Rabbi Chanan bechagiga mefual, the Baba Bati ena tamei leida, the Hainu the stam leida ktuva b'Torah, ayin beleida kederech regila. It's regular birth. כמו שכתוב למעלה, the כל דיני תורה נאמרו כפי הרגיל ולא שלא כדרכם. אבל דבר פשוט, זה תלוי הכל לפי הזמן לפי המקום. That when we say what's normal, that's according to the place and according to the time. כגון מלאכת שבת. המוציא במפרקו פטור. Someone brings out in the elbow, it's פטור. מפני שאינו דרך הוצאה בחול. אבל אילו נשתנו מנהג העולם. The whole world changes. בחול. שהכל מוצאים בפרקם. Everybody now walks around with a patch on here and they put a phone in there. There's a משוגעים. That's what everybody does. ודאי הוא חייב גם בשבת. ונהיה קבעת אילנות. אומרים שעכשיו נשתנה מנהג. שאין מרכיבים ייחור באילן, כי בשנים קודמות, אלא ששופכים מיץ הזר, we do some sort of treatment with the seeds, ורב אחד אמר בירחון שער ציון, דהיינו עוברים באופן זה ולא תעשה דרך קבעת אילן. כיוון דהוא שלא כדרך הקבע, ולפי המבואר, אין כן, אלא אפילו נאמר בשנים קודמות, אילו עשו כן, לא היה מתחייב. It's true in the past, there wasn't a חיוב, משום דאז היה אופן זה שלא כדרך המרכיבים. אבל עכשיו, שהכל עושים כן, אם כן, הוא כדרך הקבע. Why do I love that Rav Chanan? The Rav Chanan says, the Torah is a living, breathing entity that changes and develops according to the time and according to the Zman. And the Torah is not set in 3,300 years ago, and it can never be changed. And therefore, it doesn't say when Hotzat Shabbat is Isur D'Rabbanan. It says Isur D'Oraita. The Torah means what is written now, what's considered written. And then you can use it to speak about microwave, and speak about writing on a telephone, and speak about matzah, machine matzahs, 101 things. So Rav Chanan says, Azra Melachutit is clearly normal. It's clearly considered to be. That's what the Torah meant, was provable. IVF, the Rav Chanan didn't speak about. Clearly, Rav Chanan didn't speak about because Rav Chanan was killed in the Shoah, and IVF, as you will learn together, only started in the 70s, and therefore it's clearly read about. But that was what Rav Elyashiv told me. Later on in his life, Rav Elyashiv, I asked him, maybe he was a young man, he was maybe 100, 101 when I asked him. A few years later, my Talmidim asked him, maybe when he was 103 or so, they asked Rav Elyashiv, and he said also IVF is Doche Shabbat. Why? What happened? I mean, he told me the opposite. The very Mod Chashuv, and this is the very Atzuma Rav Elyashiv. A person generally, we don't like to change our minds. A person gets to 100 years old, Baruch Hashem, they're set in their ways. Rav Elyashiv understood that in the same svara that he had told me the 2 years before was appropriate for only for IUI, because that became the norm. IVF also became the norm. 7 million children have been born worldwide through IVF. It's hard to say that's not the norm. And therefore, that's what Torah meant. The Torah said that's the norm. And therefore, Rav Elyashiv said the Torah not only adapts from Matan Torah and to Rav Chanan, it adapts in his own lifetime from what I said a year ago to what I said today. The Torah has to adapt. This is a beautiful idea. Instead of get to Balei, I love that idea that sort of Torah is sort of this Torah Chaim. So it said, a Talmud said to me recently that Rav Shechter was here in Shalabim a couple of Shabbatot ago, maybe 2 weeks ago for Shabbat, and he asked him the whole question. Rav Shechter said, "No, it's not Doche Shabbat." I think it's very appropriate to Rav Shechter's idea that maybe it's also Rav Shechter didn't think that for IVF you makan the mitzvah pruvu, and if you don't makan the mitzvah pruvu, it's hard to say that it's a regular birth. The Cholofen, Rav I think it's a nice shir. Rav Poskim say that Brit Milah is Doche Shabbat. And kacha lachora, most of the mohalim kacha sover. So we saw a little bit about the concept of what's choleh b'Shabbat. We saw about how do we translate it to fertility. We saw different opinions, and we saw therefore nafkaminas of what we're allowed to do, not allowed to do on Shabbat. And in the end, with a little bit of a tam Shabbat, we had a little bit of a drasha on whether we can do Brit Milah or not, which I think is a nice shir to give you a balabatim. Sheilot.
Rabbi Weissman, thank you first.
Yes.
Thank you very much. So just a recap: a woman who needs to do injections on herself on Shabbos, that would be permitted because she probably has din of a chol l'shem b'sakana, and the injections only d'Rabbanan asir samamin. So that would be, that would be okay.
Yeah, and also the other thing we have to think about again is that many times injections are not time related. When you give the injection, you can give it a little earlier, a little later, unless it's Ovitrel, the last injection, which is time sensitive. It has to be given 36 hours before ovulation. And that has to be given. So if you're having a treatment Sunday morning, you have to give it Friday night. En malasot.
Okay. And the next thing, if in a situation where they did not time it properly, they didn't have the foresight, and they come to you with a shaila about certain parts of the IVF or IUI that have to be done on Shabbos. So if the doctor's a guy, is what to work around, because again, it's probably a chola and some la'akum, and
if they're not mechalel Shabbat, so they're staying next to they're staying next to. At the end of the day, this between everyone, we all know that in fact to go with a goy in a car is not so also on Shabbat, right? So but we don't want to be samach on that heter. So they'll stay next to the hospital, and it's all a goy, and they don't have to go in. And I remember getting in and out of the hospital itself is always fraud. We have the supervisors stay there just to walk through the doors. But again, we got around all those problems. So we would say, but the evid, especially in case of need, we would do it. We make it. Yeah.
With regard to assuming that it's based on what Valessa said, you are permitted to take the shots on Shabbat, but does it matter if she's taking the shots herself or if the husband is giving the shots? Because sometimes the husband, for simplicity's sake, gives the shots to the wife. Maybe she can't reach so easily. Is it permissible to give the shot to someone else, or does it dafka have to be that the woman takes it herself?
No, I don't think there's any. If we say it's mutter on Shabbat, it doesn't matter if I'm an administrator, if I'm the taker. The only question we had is a Chasam Sofer that says that if a person comes to you on Shabbat, on Yom Kippur, and says, I need to eat, and they look to be okay, so the Chasam Sofer says, you can't feed them, they can feed themselves. So Shlomo Zalman wanted to say that if a person having a heart attack and they look fine, then you can't drive them to the hospital on Shabbat, they can only drive themselves. So Lamaisa, we don't hold like that because we think having a heart attack is Vadai Pikor Nefesh. They didn't think that 50 years ago when Shlomo Zalman wrote it. It's something that's clearly changing medicine. However, anything that was because we think that I just don't believe the person. But if I know the person needs to have medication, there's no difference between the administrator or the recipient.
So there's no additional concern of chabura or something like that.
No. So I just wanted to say that my svara is, how do you know that it's subcutaneous and not intravenous? It can be administered by a layperson. That's what I want to say. Once you say that, then clearly it's not. You don't have the expertise to do it.
Thank you so much, Rabbi. Thank you.
Besorot tovot, shakoach, kol tov, shalom, shalom.